Hi guys, I'm Sarah Becker, Director of Marketing at VirtualHealth, and we've got a special future of care chat today focused on some of the things you might be seeing in the industry right now around prior authorization, the prior auth requirements, and FHIR APIs. So with me today is Michael Lunzer from Itiliti Health and Huthaifa Khan from VirtualHealth, and these guys are going to come and share some expertise with you. If you guys want to introduce yourselves real quick, then we'll get started.
Thank you, Sarah. Appreciate the opportunity to talk with everybody today. I'm Michael Lunzer. I'm the CEO and founder of Itiliti Health. I'm a serial entrepreneur, so I've founded multiple companies in my past. And Itiliti Health is really focused in on the prior authorization challenges that face payers and providers today. And really excited to talk to you about how we've engineered some really exciting products that customers are using today to address many of the challenges that are required to be solved through FHIR as well. So with that, thank you for the opportunity to talk today.
My name is Huthaifa Khan. I'm the Director for Solutions Architecture here at VirtualHealth. So my background is in interoperability. I think that's probably one word to describe my career experience. I've been dealing with payer data and HIEs for a little over a decade now. I have a lot of background in HL7 V2, which I'm very happy to say is moving over to FHIR as we move forward. Have implemented large payer HIEs, smaller HIEs, as well as kind of handling the solutions architecture from start to finish when it comes to intersystems communication and making sure that patients and providers and payers can get all of the data that they need to make sure that we are delivering the best possible care to everyone involved.
Thank you guys for that quick intro. And all right, we're just going to go ahead and jump right in because obviously prior auth APIs of FHIR are a big deal right now. The recent CMS ruling that came out earlier this year has obviously got a lot of people thinking, how do I get this accomplished? There are a lot of new things around prior authorization automation, timelines, the provider APIs, prior auth APIs, and a couple others in the FHIR standards. So I think the first question is, really just thinking through those requirements, the timeline for them, and where these payers are focusing. Why is it important to be thinking about the prior auth APIs and FHIR in tandem?
So for me, I think it's super important to start thinking ahead as an organization when it comes to the FHIR APIs. And there's a lot behind the FHIR APIs that I think drive this particular recommendation that I have. First and foremost, FHIR is the standard that CMS have chosen for their final rules. This dates as far back as 2021, 2022, when it came to the patient access API, the provider directory API, and the payer-to-payer API. Those are all FHIR-based. I think it's also really important to note is that the new rule by CMS 0057F does require the prior auth rule to be incorporated with the patient access API. So it's super important to understand that it's not just the prior authorization process as far as FHIR that we're talking about here. It also requires and kind of backdates a little bit of that compatibility into earlier FHIR-based rules that CMS have introduced. And that really speaks to, I think, organizations needing to get on board earlier, because it's not just a single process that they're dealing with here. It's kind of a wider ecosystem of interoperability that CMS are pushing around FHIR, and getting onto that sooner rather than later. And I think I'm very well qualified to speak on this, getting around to that and really starting to push your internal enterprise architecture towards that sooner rather than later will reap benefits, not just from a business perspective in terms of the return on investment when you're incorporating or integrating with new systems that you're bringing on into your enterprise, but also meeting that compliance requirement sooner rather than later, and having that time, to address any changes or concerns that CMS might raise between now and, I think it's 2027 is the enforcement date for that particular rule.
So that's really good background, Khan, on FHIR in general, and the importance of how health plans work with FHIR today. What I'd like to address is the specific timeline around the CMS FHIR prior authorization requirements. Essentially, what we've heard from CMS is they anticipate that it will take 30 months to become compliant. And if you look at the required date, it's January 1 of 2027. So I'm trying to get people to stop thinking about 2027 and think about this as end of 26, because that really shifts things a whole year in perception. And then when you back up 30 months, that's July of this year that people have to really get started on their prior authorization initiatives. So a pretty urgent timetable to get started. And then another key element is that there are a lot of things to do in this requirement, and many of them can be started now and are not big major lifts, but they're important to do now to set the foundation for the future. So specifically, for instance, most health plans have their rules in spreadsheets and PDFs. So the spreadsheets for their code matrix and PDFs for their medical policies. Well, and then in many cases, health plans, spreadsheets and PDFs are not even up to date. And that's because of the fact that they're not in a structured format. They haven't been reviewed in a long time. And so as we work with health plans, we find often that when we start to move their spreadsheets and PDFs into a structured capability that we deliver today for is-auth required outside of FHIR, we find lots of changes that they need to make to their data to make sure they have their rules all consolidated. And then once they get them into our system that supports their interactions with providers today, it's as simple as turning on the FHIR interface for our system to be able to talk directly to Epic and other FHIR compliant, CMS prior auth compliant EMR systems. So again, it's really critical to get started today. There are some low-hanging fruit elements that will bring big value to the process for the health plan. And in terms of today without FHIR, those big value outcomes are there. And then with FHIR, those big value outcomes are just streamlined in the way the provider can interact with the system.
Yeah, I do want to touch on that word streamlined that Michael mentioned, which again, as an interoperability professional is kind of our entire goal as far as getting data moving from one place to another. Streamline really is the goal. And I think CMS have done a really good job of advocating for FHIR. Don't get me wrong, there's still a lot to be done. I think that they do need feedback and to be pushed to really kind of provide clarity on certain bits and pieces as we go through these rules in the same way that we have with some of the prior rules. But coming back to the benefit of FHIR, it's a standard. And when we say that, we don't just mean like with HL7, that was just a data format, right? It was just this data goes into this position on the file behind this many pipes, or this data format, ADT AO1 is for this event, ADT AO8 is for updating. You have OIUs and ORMs for lab results and lab requests and all the rest of it. FHIR does all of that in a format that is industry agnostic, in the sense that you can use XML, you can use JSON, and this does get into the more technical aspects, but I think really speaks to why it's so important. It uses an industry technology standard as opposed to a healthcare specific one, which means that most systems that you're dealing with, even for example, systems that aren't healthcare centric, we deal with interfaces coming from places like Salesforce, for example, that can deal with JSON very, very easily. But ultimately, the big benefit is that it doesn't just talk about the way that the data is structured. It also talks about the way that you operate with that data at a technology level using APIs, right? What do your search parameters need to look like? At the moment, if as an enterprise architect, you're looking at integrating 3 separate systems and they're all API based, without FHIR, you have to go and check the documentation for each one of them, translate your central system into 1, 2, 3 different formats, all with different authentication methods, which FHIR also addresses, different parameters in the way that you interact with them. Whereas with FHIR, you can use, or at least expect, that 90% of your interaction with that system, assuming that they are FHIR compliant, is covered. So it really, really drives that word of being streamlined. And for me personally, driving more towards interoperability because you're no longer locked in to one particular vendor's standard of doing things like we have seen in the past. So yeah, I think that Michael really touched on that bit when it comes to that streamlining, and really outlines the importance of FHIR in the current market, as well as why it's so well suited and why CMS have chosen it to drive these rules across the industry. Yeah, I do.
Both of you, and obviously the word streamlined has come up. So thinking through some of the benefits, obviously with that, you're automating prior authorization here, expediting those. You're obviously able to have better communication between systems here with a standardized format. The other things that we've kind of seen come up, at least from reading from CMS and talking with them, right, is that the push behind this new ruling, the push behind FHIR, the push for these changes in regulations around prior authorization is also to help provide a little bit more transparency and information to patients, better communication, right, between providers and payers, but also between providers themselves. So can you guys touch a little bit on why healthcare payers need to be thinking about both these things together right now, because of not just thinking through meeting CMS requirements, right? Thinking through how they're improving their organizational operations, how they're able to improve utilization management and care management as a result of these, which ultimately lead to health outcomes. Can you guys just touch on that a little bit too?
Sure. As I mentioned earlier, one of the things that we find with health plans today is that in their poorly constructed data repositories of spreadsheets and PDFs, things get out of date easily. And of course, as a provider interacts with a payer, any of that data that's out of date is going to potentially cause a conflict, a bad decision that needs to be disputed later. And so this creates lots of friction. And so this CMS future world is going to decrease a lot of that pain and friction that takes place. And so that's why it's important that we address these FHIR and CMS requirements from multiple levels. So not just at the high level FHIR side of things, but also at the mid-level application interactions, and even at the lowest level, the data. And so in order to address, when these are all addressed together, their provider partners will be more sticky with them. As we've seen of late, there have been health systems canceling their relationships with major health plans because of the burden that their systems and processes place on them. So there's a competitive opportunity here for payers that embrace efficient, streamlined processes to have better provider relationships, potentially better contracts, and of course, better outcomes for their patients, which all comes back to feed into their market share and revenue opportunities. So it's all interlinked, and if a payer does a good job in this area, they'll be rewarded many times over.
And that multiple levels piece is super important for me, coming from an architecture background. Because of the way the FHIR API works, sure, you can design your own facade that meets the requirements of the FHIR API behind it, right? And have whatever you want internally, but ultimately it pushes organizations to adopt those standards internally as well, which ultimately drives a lot more of that value that Michael's referring to here. Because think about this for a moment, right? The rules engines that we have or don't have, something that Itiliti addresses at the moment, which I really like. We did an implementation for one of our health plan clients, and it's been amazing to see that kind of streamlined approach to the way that things are done. I've heard from users that, like, yeah, now rather than having to go through, change it in one spreadsheet, one PDF here and one thing over here, it allows for them to change it in one area, and that propagates across their entire organization from an architecture perspective. And it also then propagates in the systems that interact with them and work with them as well, without the need for having all of these explicit processes for each one individually. I think for me, one of the really cool things, and I'm gonna post up a little bit here for Itiliti as well, because we've worked with them a bit now, and I really have enjoyed it, is the ability to kind of set up the three different areas of that. So that transparency piece that we spoke about before of a provider being able to check before they go through the whole process of prior authorization is, do I even need to do this? Right? Based off my patient health plan, based off the procedure that I want to do, you instantly now save money for the providers. And it also means that getting to that care for the patients is quicker, which ultimately leads to better population health and much less cost from a health plan perspective in order to keep that population health status up. One other thing, and this is something that I really like about FHIR, because personally, and I've spoken about this before, growing up, I've had a myriad of health issues, one of which was IBS, and this was back before IBS was even really identified as being a proper thing. And this was back in New Zealand, which had a pretty decent, IT health system set up, is that every time I would go to a new provider that they had referred me to, I now have to answer a whole bunch of questions all over again, right? So not only does that put stress on me as a patient, it now drives the providers to have to redo a bunch of work. With FHIR, it doesn't matter now which provider you're working with. So long as they're FHIR compliant, you can send all of that information beforehand, which means that they spend less time. They bill less ultimately for having to do additional observations or additional tests, which ultimately saves the provider, the health plan, and the patient time and money in getting to a resolution for a particular health issue. And FHIR allows for that because, and I'll touch on this again, it's not system centric, right? You're not locked into a particular vendor anymore. It is industry wide and it's open source. Everyone can see it, everyone can look at it. And it allows for adaptability between different systems as well. I'm going to be releasing a post towards the end of April around extensions and how and when you should use them in FHIR. But it really speaks to that ability to concisely provide all of that information so that there isn't that constant repeat and cycling, which again, I think ultimately leads to better outcomes for everyone, financially, mentally, emotionally, and physically. So I think that speaks to pretty good returns ultimately on that investment, and getting to that sooner rather than later is going to be a huge help. And
the future looks really bright when data is in place that is accurate and connectivity is in place that lets that data move. We see immediate results in terms of return on investment from streamlining prior auth and getting data to move efficiently and make decisions quickly. But just imagine the future when that same data can be put to use for other purposes, for care management and population health and other reasons, because it's portable, because it's standardized, and it's now able to be used more efficiently in other systems. So it's really an exciting future when we get to the end of this FHIR world. But the first step is data, right? Data is the foundation, and Itiliti is excited to be working with VirtualHealth to address the data issues and then the ability to move and leverage that data in systems. Our partnership with VirtualHealth has really shown some great examples of how that can be leveraged to bring value, and we're really excited to see what the future can bring.